Olga, Masha, thank you for that presentation. It was a pleasure to hear about ACP and their initiatives. So next up we have Ms. Dasha Dubero. Dasha is a dedicated pharmacist specializing in quality control and public health care. She holds a bachelor's degree in biopharmaceutical sciences from the University of Leiden and a master's degree in pharmacy from the University of Utrecht. Dasha further pursues specialization in public pharmacies with a focus on quality management and pharmaceutical care. She currently works at Botica di Servicio, where she is responsible for ensuring the highest standards of quality control within their pharmacy. Dasha's commitment to enhancing patient care through meticulous attention to detail and her drive to continuously improve healthcare services has earned her recognition as a rising leader in the field of pharmaceutical care here in Aruba. Her focus on quality systems ensure that patients receive safe, reliable, and effective medications in a well-regulated environment. Dasha, the floor is yours. A warm welcome to her.
Hello everyone. First I want to thank Eva for the invitation. I'm very honored to stand here before you. My personal goal for this year was really the visibility of the pharmacies and the pharmacists, because I saw that not a lot of people knew what we were and what we do. We're not Dasha schrijvers. So that was the main goal for me. So even though this is a bit scary for me, I'm here and I want to walk you through what we did the last 3 years since I've been here. And honestly, to toot our own horn a bit, because I'm really proud of my team of what we achieved in the short amount of time that we set out to do it. So I want to take you with me on that. So first, no conflict of interest. So we had a lot of presentations this morning. We got the why of quality, we got the what of quality, but now I want to take you with me on the how. So you're very inspired now after hours of presentations. You want to do it on Monday, but how do you even start? So I want to take you with me on in the summer of 2021 when we set a deadline and we wanted to achieve it, and we all looked at the same thing, and that's what we wanted to do. So what does that look in reality? To talk about that, I want to take a brief look at what was the situation then in our pharmacy, at Botica di Servicio, and what is it now, 3 years later. Throughout the whole presentation, I'll be talking about the practicality of a quality management system, just to see what it means in reality. Also, how do you even start? What are the first steps that you have to take? What are the mental capacity that you have to be at? I also want to talk about what does it really mean to implement a quality management system. So that means I want to show you a very simple example of how we're continuously improving on this matter. And then I want to talk briefly about what's next. So I think the words jumbled up a bit. But what was the situation in summer 2021? So the reason we had such a strict deadline is because we had a very specific goal in mind. Like Rocio said, I am a community pharmacist. That is a specialization. That's next to the main Master of Pharmacy. What this is and especially you can look at it a bit like high science. So after your master, you continue on in the community pharmacy or in the hospital pharmacy, whatever you want. The community pharmacy is very specific in it teaches you how to handle complex chronic care, but also very much the quality of care. And that's the goal that we had in mind for Botica di Servicio. At that time, we only had 2 openbare apothekers, community pharmacists. But we wanted to have more. We wanted our pharmacists to be able to give that care to the patients that we have. But this is a Dutch study. It's a learning and working at the same time. And honestly, we had to do a lot of convincing. My colleague Adrienne can talk about that later. We had to do a lot of convincing in the Netherlands because honestly, sometimes they think we live in a hut and we have 3 medications in our pharmacy. So we really had to convince them that we are capable to do this. And in order to do this, we had to have some kind of quality management system in place that proves that we are the same level as a Dutch pharmacy in order to give that study and to help the person to achieve that goal. In order to do that, we picked the framework of Harmonisatie Kwaliteitsbeoordeling in the Zorgsector, that's the HKZ. That's the norm that all the Dutch pharmacies have to achieve. What it is for us, later on I'll talk about in general, but for us it means that it's a standard for quality systems of public pharmacies. It focuses on the pharmaceutical care and services. But the main thing is essentially ensuring optimal care for patients, so patient satisfaction and safety. So the satisfaction is a very important one because if a patient is not happy, then the care goes down. But safety, that is for us because we are the last step before a patient takes the medication. So that is very important for us in the pharmacy. How do we achieve that? We have to have an external audit because we cannot just say to the Netherlands, hey, we're good. We have to have someone outside of our view to do an audit on us and to look at the ISO certification and tell us if we achieve it or not. And then we get a certification. But we had 2 months to do that. So building a quality management system from scratch in 2 months was a very big goal. But our 2 main goals was actually just to create a working structured quality system. But our biggest challenge was to get everyone on board. So we just told assistants, hey, let's go. That was a bit more difficult, but it was just like these 2 goals were in one. I'll just reveal it, we did it. Here's my beautiful colleague Adrienne beaming with her big certification. So we did it, we're very proud of it. What is the present day? So we have yearly external audits because once we get it, that does not mean you'll get it forever. You have to keep making sure that you're improving and you're keeping up with what you set out to do. This means we have yearly and monthly calendars with the framework of our quality system. So everyone knows what we're doing at all the times because we have like a system to help us called EQs, which follows the PDA cycle that I will talk about in a minute. We have to identify areas for continuous improvement of high-risk processes. So not every process in the Botica is high risk. There are some types of things that the processes that the assistants do, that the pharmacies do, that can mean if it goes wrong, it's very damaging to the patient. And that's what we want to keep looking for. And then continuous operational efficiency together with the pharmacy assistants. This is very important because they are the ones on the floor. We are not always on the floor. So if you get them 20 things to do in one day and 19 of them are not efficient, they're not going to do it. So we have to make sure that it's still working for them. And we do that with meetings with them to get their input. So the end goal is continuously improving the health of our clients through safe and effective personalized treatment and medications. There are a lot of words, but it basically means that we just want to be our best for the patients that we have in front of us at the body. So, Eagle, we did it in 2021. We wanted to start small. We didn't want to do all 4 at the same time. And then in 2024, the last January, we achieved it in Nord as well. So Nord is also a HKZ certified pharmacy. And then we have a big goal in front of us next month because then we will do all 4. So we will add Santa Cruz, so it's Maria, and we'll add Cerro Preto, where I'm currently at. So that doesn't mean that only Maria and Cerro Preto are going to be audited in October. That means all of us is going to be audited again. But how do you even start? Just look at my notes a little bit. So what were the first steps in achieving this? Where do you begin? Because you don't just begin by creating a massive to-do list, which is what you will probably do, but you have to get your mindset in a specific way. So you make sure the vision, the goals, and the commitment to quality is equal across the workplace. If you have some people that are not on board, it's going to make the process a lot more difficult. Like I've heard in presentations before, if you as management come and say this is what you have to do and then don't explain anything, there will be a lot of questions, there will be a lot of hesitations, and that we have to learn in the hard way. We have to create a culture of quality, so we have to ensure that everyone wants to improve, that they want to see the better service for the patients, but also with the working relationship with the prescribers. We had to set very specific goals, and I want to highlight specific, measurable, attainable, relevant, and time-bound. I think mostly everyone in this room is familiar with the SMART objectives. That was very important for us because you do have a lot of working components, but you also have a lot of people. Additionally, you have to communicate your why, what, and how. I started with that in my presentation, but this is what we live by because it has to be clear. Where do you start? You set out what you want to do. That's basically it. So you set up policies and procedures. So you say, this is what I want to do in that way. And that will be your quality manual. That will be basically your Bible. We open that daily as pharmacists. We're trying to get assistants to also come back to that still. But this is where you say and where you can always fall back on what you want to do. It's a bit like manifestation. You say you want to do it, and then you achieve to do that every day. I want to just highlight one specific thing that people often forget about is document control. Because you are continuously improving, that means you will change things. But if you don't know what you change, it's very difficult to keep it specific and keep it attainable for everyone. There will be a lot of confusion, so I just want to include that. So the next step was the training and engaging employees and co-workers. So one tip I would have is to make sure you have a qualified and willing person to be the one to answer questions, because you will get a lot of questions. So there has to be one person that everyone can come to and say, hey, how do you do this, or what is your goal? Additionally, you want to make sure that the employees understand the importance of quality. That was the why that I talked about. How do you do that? You create checklists, you do employee questionnaires so they feel like they are being heard. And we do something with that information, and we repeat it on a specific time frame. And the sense of ownership, that is the biggest thing, because if someone feels responsible for something, it will be more likely that they will do it and do it right. And that they feel that they need to do it to improve themselves. One also things to integrate audits and quarterly checks. So audits for yourself, because you set out to do something, you write it down beautifully in a procedure, but is it still relevant to your the space that you have now? What is going on now in your institution? This is something we got as a tip also from our yearly audits, because we written a beautiful manual. It's very long, it's very specific. But then the auditor asked us, okay, but how do you test it? How do you know that what you written down 3 years ago is still relevant? But also make it manageable. This is the biggest thing, because I think everyone here has been at Botica at 6 p.m. on a Friday night. It's very busy sometimes. So there has to be something that you can do during the day that you can achieve, that it will be achievable. So you have to make it manageable. You have to make it that it's not impossible to be able to finish on time, because you don't want to be crunching right before an audit. So next I want to talk about what it really means to implement a quality system. So like I said, we have the Harmonisatie Kwaliteitsbeoordeling, and the Zorgsector is a really long word. This is a Dutch organization. It's only in the Netherlands. We were the first pharmacy to achieve this specialization for the pharmacy outside of Netherlands. Now we have North, and our colleagues in Curaçao has also obtained it in January, so we're very proud of them. Developing, so basically for other institutions, it's developing quality and certification for healthcare providers. The framework is institutions deliver high quality services in a structured and consistent manner. That's basically it. It has to be structured, but it also has to be that you are doing it the same every time. So the focus is ensure services are client-centered, safe, effective, and continuously improving. And I just want to highlight one small thing. I'm saying that it has to be consistent, but that doesn't mean that if something goes wrong one time, you have to change your whole procedure, you have to add KPIs. That's not it. It's about the process. So for us, the hackathon was really about showing that we're continuously improving. That's the main thing. So if something goes wrong one time, that does not mean that your whole process is wrong. It just means if it goes wrong 2 times, 3 times, then you really have to work on the process because probably something is not going right. Okay, so I just want to highlight quickly the Plan, Do, Check, Act. I'm not sure if someone has seen it before, probably the quality people. But what it means is this is a cycle that you will be constantly going back to. I think for most people the act evaluation is something we often forget, but you always have to look back on what you did and see if it's actually worthwhile. But I'll go step for step. So the plan. We talked a bit about the kwaliteitsbeoordeling. This is basically it. So what high-risk processes have you identified? What is in your own institution that you see as high risk, that if something goes wrong, it will mean that something is really wrong? What projects do you want to achieve this year? What do you want to improve on? How do you plan to achieve this? So objectives, the strategies, and the metrics. And then on a smaller scale, something went wrong, do you have a plan so this can happen again? To able to do this is the manager review, like the kwaliteitsbeoordeling. This is honestly the basis of it. The auditor always asks for this, which we gave it the kwaliteitsbeoordeling. And then the root cause analysis is very important here. So if something went wrong, why did it go wrong? What steps in the process happened? For us, it means that it happened when the assistant was working on the prescription. Did it happen when the patient was actually there and we gave the medication, for example, a different name or anything like that? So you really have to dig deep to see the why. And then you have to ask yourself 4 times why to get to the root cause. So I want to give a very simple example of how this would look for us. So for example, a patient came to our pharmacy and said, I don't know what to do with this Clixana. So it's like an injection. I don't know what to do with it. Do I just throw it away? Then we saw, oh, we forgot to give a sharps container. And something can be very damaging because if other people come in contact with that injection, it could be a big problem. So we wanted to do something with that. So we identified the problem and planned the solution. So we plan to meet the assistants and add into the meeting. So we have monthly meetings with the assistants. And then we added a text. So just like a simple pop-up text, if an assistant is writing the enoxaparin, so the injection, a pop-up comes up and says, literally, don't forget to add sharps container. It's very simple. So next, the do. You actually have to do it. You implement the plan and then you test for effectiveness. So you implement it, you check with assistants, you check with your colleagues, is it working, or are you seeing a difference? We usually do it with the meetings that we have with the pharmacists, but we also talk on one-on-one. We collect data, so we perform tasks, we give information to co-workers, and then we track the progress. So in this case, we implement, so we spoken to co-workers to alert them that this has been happening. And then at every prescription, like I said, pop up, don't forget to add the sharps container. The check part, we evaluate the results. So we measure and compare goals set. So if, for example, we said we want all the injections to have a sharp container, we check that. And then we analyze the data, is it giving the desired results? And then we do that with performance indicators. What this means is very simple. You say, for example, in this case, I think we said 90% of all the injections of the specific medication has to have a sharps container. Then when that performance indicator pops up, we look at the last 10 prescriptions and then we just calculate it. If it goes wrong one time, you talk about it, but if it continuously go wrong and then you continuously don't get the goal that you set out to do, then you have to go back to the drawing board. And then, like I said, the evaluation. So in this case, we added a performance indicator called now the containers to the calendar. And then if after 2 times we don't get the desired results, we have to act. Either we have to check it more often, even maybe think of something else to do so that the assistants don't forget. To act, we standardize the solution, so if it's successful, we roll it out. That means we add it to the other pharmacies, we bring it to a higher scale. We can even decide to add it to manual. Usually for things like that, we don't add it because otherwise it will be a very long book that no one will read, and then you can't find anything. But if it's something on a bigger scale, like for example a yearly planning that we develop, then we could add it. You address any remaining issues that you get from the people that are actually doing it, so the assistants. And then continuous improvement. So just because it's going right now doesn't mean that in a year it's still going right. So you have to keep checking it because this is a higher process that we saw. So again, the performance indicators, if it goes right, great. If it's, let's say, every 3 months and it goes right for a long period of time, then we can always make it a list less often. So we do it, for example, 2 times a year to check. And then we implement the standard. So in this case, we do have like a very simple Excel sheet quality agreements. This is for these types of things described in our manual. And this one we added it. So it's like a working processes that's very simple for the assistants to see. It seems a bit much, I realize that, but we have learned that you have to be as specific as possible. Because if you're not specific, you will not imagine what people will read, but it's not what you intended it to be. So you have to be very specific. Okay, so we have developed, and this is the expectation. It's a bit small, but it doesn't matter. You can see the green. This is what you want, right? You want every month everything to be green. Everyone did what they had to do. Everything is described beautifully in a whole 3 sentences. But this is usually the reality. Things are not being done, or they're still pending. So this is really something you have to realize is not going to go perfectly. So you have to set your expectations. You have to realize that life happens. People get sick. People get pregnant. You have understaffing. It's very busy. Life happens. But you also have to have a plan to fall back on. So what are your processes that have to continue on, the checks that need to go on, and which ones you can limit, or that you can say, okay, I'll not do it this month, I'll do it next month. But you have to have like a sort of a, like Eisenhower matrix, if anyone recognizes that. What we learn is that we have to allocate time in the schedule dedicated to quality tasks. Because like I said, the boutique can be very busy, and the patient is always a priority. So if you're lucky to have a bit more room in your schedule, allocate that time, because that's the time for quality. That's the only way you can keep this going on for a longer term. And like I said multiple times, you have to have clear meeting minutes, you have to have clear procedures on every aspect of your QMS. For example, we got a minor non-conformity for the non-audit people. That basically means it's not a major, it's not all hell breaks loose. It's just a minor that the auditor saw, and we needed to give feedback on it. We needed to make sure that we be very clear of what we're doing to achieve, to improve it. But basically, due to all the things we have a different text in the manual than we had in the performance indicator, and the auditor sees everything. So she saw it immediately, and it seems like a minor thing, but eventually that led to assistants in one location doing completely something else in another location because it was not understood. So this is a very simple example of what can go wrong if you're not clear enough. And you want to avoid this statement, I didn't know the agreement. You don't want that. Also because it's kind of embarrassing if the auditor asks and you answer that, but also because it makes sure that we're not on the same level, and that is one of our main goals in our boutiques, is so every location is working equally. So you have to communicate your expectations. If you don't know what you're wanting to achieve as management, as quality person, as someone who's implementing the system, then the people cannot do anything with it. They need to know what your expectation of them is, of what the system should be. So, what's next for us? We're continuing the improvements. Like I said, next month we have a big audit coming up. And now, 3 years later, I'm less of the to-do list has to be done, more of a making sure we don't fall into the bulletist habit, as I like to call it. So that means we're just finishing everything up without really looking at what we're doing. Because sometimes they can have 30, 40 tasks for that month, and then the tendency is to just get it done, but then we're not looking at the improvements. So to do that, we have to repeat our why, what, and how every chance we get. So we have a few times a year, we have a NASCOLings, or like a meeting with all the assistants, and then we talk about different things. And this is something that continuously is being repeated. But we also have to look at efficiency. So we have to look, do we really need all these hundreds of performance indicators? 3 years on, we learned quite a lot, and we're not adding a performance indicator every chance we get, which was the case in the beginning. We're really looking at what are the processes that really need to be looked at, and that's the way we plan our calendar now. So when is it enough? But the main thing, this is all beautiful, great talk, but the patient is always a priority. So everything you do, this is always next to it, but in order to give the patient the best care, you do have to have a system in place to ensure you're doing consistently efficient work. Thank you.
Masha, thank you, Dasha. Ladies and gentlemen, the floor is open for questions.